So
you feel that the Democrats have let you and the American people down as well?
yes, I mean, I think what's happened is the Republicans have become right-wing extremists. Their views are way out of touch with where the American people are. But I think the Democrats have also been heavily influenced by big money. Do you think you go out to any area in America, working class area, and go up to people and say, do you think the Democratic Party is there vigorously representing your interest? People will not say yes. I mean, have the Democrats been good on a number of issues? Gay rights, I support that. Women's rights, I strongly support that.
What about Obamacare?
Obamacare is a good, moderate Republican proposal which does some important things. It expands health insurance to another 20 or 30 million Americans. Very important. It puts some restrictions on what private insurance companies can do. But if we are serious about providing health care to all people in a cost-effective way, what you got to do is move to a Medicare for all single-payer program.
When you say single payer, you're talking about nationalized health care.
No, actually you're not. That's what the United Kingdom has. That's what the National Health Service, what they have. Single payer is what they have in Canada, which means you have one payer, so you don't have private insurance companies, but people can go to private doctors and clinics and so forth.
But the government is still the single payer.
Yes, exactly.
And that means what for me as the taxpayer?
Here's the good news for you. Guess what it means? You don't have to pay Blue Cross Blue Shield $16,000 a year anymore. Aren't you delighted?
So if we were to redirect funding...
Look, I mean, I've been subjected to the 30-second ads that talk about what you want. And as Bernie Sanders wants to raise your taxes, yes, your taxes will go up. But you do not have to pay the $12,000, $14,000, $16,000 a year to a private insurance company.
I'm sorry, I do get stuck on the... Here's this guy, served 16 years in the House, and is in his second term in the Senate. And you know the world that you're in. You know you're the one socialist on Capitol Hill.
But I also know, Joey, that I live where I happen to live, in Burlington, Vermont, is 1 hour away from the Canadian border. And you know what? Canadians don't look any different than you or me. They don't talk any different. They have been operating under a single-payer healthcare system, I think, for the last 30 years. And you know what? They like their system a hell of a lot more than Americans like our system. And you know what? We end up spending twice as much as do the people of any other country, and our healthcare outcomes are often not as good. Now, does that make sense to you? I don't think it makes sense to people. So your suggestion that people are going to be really frightened by this idea, and they're so dumb that they can't figure out that it's a good thing not to pay $16,000 to a private insurance company and to pay $10,000 more in taxes. Oh my goodness, they can't figure it out. I don't believe that.